Welcome to Inside the Bot, the podcast that brings you to the forefront of business automation. Brought to you by OpenBots, the game changer in the world of intelligent automation. Ever wondered how to streamline document processing from months to seconds? Or how to skip those pesky bot licenses? You're in the right place. Stick around for our BYOD, Bring Your Own Document segment, where we tackle real data challenges and ready to gain insights from experts on AI, RPA, and all things automation. Don't forget to hit that follow button to stay in the loop. You will not want to miss this. Now, let's get automated.
Data is such an overused word. I think for healthcare, we can talk more about, okay, what kind of data are we talking about? Like, let's put it in layman terms. What kind of data, the scale of the data, and what we're here to do with it, how we're here to improve, I guess, that flow between it.
Yeah, what you're really talking about is you're capturing the patient experience and this an accumulation of that experience, and it's just digitized in that kind of form. The data is the form that you can understand from machine to machine type of thing, but that human to technology back to human interaction is really what we're referring to.
Yeah, the patient experience. So I like how you put it. It comes in the form. So talk more about that. Okay, so we've got our patients right now having a bad experience because of a data problem.
Oh my God. It really is. And that is because in the healthcare system, you have disparate systems. It looks and it feels like it's just one building, let's just say one entity, one facility. But actually, a hospital is made up of many different businesses within the walls of a hospital. Well, what does that mean? That means a lot of your data is siloed. A lot of it does not talk to one another. There's no what you would call interoperability or data management of your patient information just in one central location. So there's a lot of integration, there's a lot of APIs, and anybody's ever gone to the hospital, they understand what I'm talking about. What is it like on your side of the ball, the user experience? You walk into the hospital and then boom, hey, Jason, give me your name, address, information. Like, all right, no problem. Then
Grant, I filled that out. I filled that out already before I came in. Why are you asking for it again?
Like, yeah, well, I'm sorry, sir, but we need your information again because radiology does not talk to, the main hospital system. So we need your information again. So you do it again, right, Jason? Thank you very much. And then they send you over to another department, right? You've got to get some more testing. Thing like, hey, can you fill out this information? So you can see the cycle goes on and on again. Sometimes it's paper, sometimes it is digitized, but because of disparate systems, they don't talk to one another. Not enough information is pre-populated, and that becomes a fractured patient experience all the way around.
I mean, I relate to this very deeply, and so I just want to bring it to the personal level too, because I think it's good we get so caught up in the mechanics of what we're trying to do. But so recently, I moved, and I have 3 children, and I had to get to a physician. And they're still in network with the same physician, and they're basically the same company, but because they're a new patient in this region, it's the same information. But I had to fill out all the same information for all of them again and again, and it's very time consuming. And from the patient experience, we are busy professionals to have to put that information in a company that shares the information. It's just a little bit. It seems like, wait a minute. Hasn't the technology advanced to kind of help us out with this? And it seems like the data is there somewhere, but because of this disparate system, we're not able to streamline it. So where do you come in? Because I know that you love data, the conversation around it. So where do you come in with creating a solution? Is it a Band-Aid solution, or is there something long-term that we're going towards?
Well, here's the deal. There's regulation. And there are other considerations when it comes to patient data. PHI is heavily regulated from a government standpoint. There's HIPAA compliance. So there's a lot of regulation that has to be considered when sharing different types of information. Now, my proponent, what I like to see happen is that each individual should have their own data. You have your own information. If you've got now in emerging technology sets, you've got information that you're collecting. You should be able to have on your person, just like you have a driver's license and anything else, that you can then upload. Like, oh, you need access to my primary information. You know, especially like your name, address, phone number, that type of thing. That you have now, you can upload directly to a healthcare system. You give them permissions because there's got to be permissions. There's a lot of cybersecurity consideration needs to take place as well. You're going to have some two-factor authentication to make sure you are you, and you have permission to transfer that data. I see that happening more and more. So you're not just dependent on the facility having your data or an individual or a doctor. You have your own data that you can easily share with any facility that you're interacting with from a healthcare perspective. So it makes it easier as we move forward. I see that happening as a trend.
So would this be, aside from the technology, what comes to mind is very, very strange, but the AirPlay, if you ever used it, if you were sitting in a room with me, I can take a photo, but I can send it to you instantaneously. I can send you that data right away. So would it be something like that? If you're there at the line, so you, instead of filling out those forms, you're there at the clinic, you're there at the dentist office, wherever, maybe even the veterinarian for your pet, whatever it might be. Is it something like that where you're going to securely send it right then and there? How would that work?
Oh, very easily, just like you do with Google Pay or Apple Pay or anything of that nature, where you just tap it. You'll have, instead of having a point of sale system just to say only at a doctor's office, you would just tap your information, boom, it's already uploaded. And if there's any additional information that's needed, they'll just ask you, but it becomes very simple. You don't have to fill all this information out. It's already pre-verified. There's so many ways you can do that now that you don't have to go through the long, arduous process of filling out the paper trail. We need to get away from that completely. And as you asked before, is the technology available? Yes, it is. It just needs to be implemented.
Are there marquee healthcare facilities that are currently doing this or talking around doing this from your experience, this kind of Apple Pay, PHI information?
I believe so. There's a lot you call your patient portal. Digital transformation is taking place. Healthcare has been a laggard for a number of years in adopting these new technologies, but they're taking a page out of what I would call hospitality's page book, the Disney experience. I don't know if you've been there, you got 3 kids. I think you're in the Orlando area. You can probably appreciate this. You go to Disney, you pay once, you fill out, they gather your information. They give you like, I think it's like a little Fitbit type of device, right? And then you can go throughout the entire theme park. You can pay with it. You can get on the rides with it. You can get information with it. You can get into your hotel with it. And that's all you need. That is where healthcare is going. So once you've done it once, it's one to many will be the process that I see going forward. It's just a matter of getting all the other players that are involved in the healthcare system to then opt in. And there's technologies around that. And I think we will get there because we have to get there because the consumers are saying, hey, wait a minute, we need to do this going forward. So the consumerization of healthcare is going to take the lead.
The Disney analogy got me thinking. So healthcare, it seems like the patients, for the healthcare experience, they're stuck at the door, just filling out, buying the ticket to get in to experience that service, whatever it is. But you're saying, so like a Disney experience, they're equipped with data. That means that they not only get in the door and get service, but then they get advanced things. They get to go to the Bell Castle. They get to do all these other things. And the data was the key, right? That allowed it all to happen, to get their Fitbit, to get their FastPass, whatever it might be for the back end experience.
That is absolutely correct. It's going to happen. It's happening in certain systems. And here's the key, Jason, is that let's just say you're at a particular facility. I know you're in Orlando, maybe you're at Orlando Health, but yet you were down in South Florida, you were visiting folks, and then you ended up having to go into Jackson Health System just because something occurred. You want your data to follow you. This is what's happening now. Right now, Jackson, you would get checked in at Jackson, you get some basic information, but you don't know anything else that happened along the way. What is your history, your medical history? And time is of the essence, especially in a medical emergency. So wouldn't it be nice that whoever is treating you would have instant access to your most recent medical history, and that it's available from Orlando Health, that now you have now at Jackson Health? That's going to help the physician. It's going to help the payer, whoever the insurer is, and it's going to help you. That's what we're getting to. We're going to talk about this at the upcoming HIMSS conference as well.
Yeah, and speak about your role there, because we're gonna be at this conference too, because we feel like we need to be in front of the folks that are making decisions, that are experiencing this day to day, from the top, middle, bottom as well. So tell us about your role there at the HIMSS conference, Integrate, coming up here, and what people can expect from it.
Well, thank you. I am the program chair for South Florida HIMSS. We have our yearly Integrate conference where we bring together the C-suite executives from all over South Florida to come together and really talk about and champion some of the issues that are happening within healthcare. And even as we speak now, you see there are strikes going on over in the West Coast of the United States. And that's really around the workforce and what the workforce is experiencing and what they need to go forward to provide the best amount of care. We are in a crisis now in healthcare when it comes to, do we have enough people to do the actual service? And this is a big thing. And then do we have all the financial mechanisms, the operational standpoints, all the different touch points that are necessary to have a positive patient experience? Let's talk about this. And we understand that technology could be that game changer. If it's a lot of let's take away some of the red tape that's been around technology and make it happen. We learned this through the telehealth that occurred during the COVID time frame. Telehealth had been around for 10, 15 years, but it got adopted. So what we're talking about is technology adoption, something that's already available, but now it can be adopted because it's on the same payer level. But what that does is now cut around, down the amount of time it takes to see a physician. You don't always have time to drive. You don't always have time to get there, real time. So you can do it through a technology interface and get exactly what you need from a care perspective. This is going forward. Now you can do this in a lot of other ways as well. So we want to take out the friction that you experience in a healthcare setting from a patient experience, as well as the workforce. The people that work in the healthcare system, they experience a lot of angst as well. We need to fine-tune our technologies to work well within our healthcare systems. And we're going to talk about this, about the future of healthcare in 2030. That is what the theme of our conference is all about. It's Digital Horizon 2030, pioneering in the healthcare going into tomorrow. We're going to hear from CEOs. They're going to talk about their perspectives. We're going to hear from chief information officers and their perspectives. We're going to talk about AI and where does that all play within the four walls or outside of that in the community of health advocates. So all of this is going to come together. There'll be November 9th at the Levon Innovation Center, in which OpenBots is going to have a great session on digital ethics. And I cannot wait for that particular session.
We're excited about it here. For a theme for this conversation so far, I would like to go back to something that I think is very important that you definitely touch. We spend so much time focusing on patient experience. But what about the staff experience? What about the doctor? What about the radiologist? You made a comment earlier that there's a staffing issue. So is that because they are not having a great experience in their healthcare system because they're bombarded by being the manual worker of that data? Are they just carrying that data around, moving it to one system to the next, copying and pasting? Is there an issue there with their experience? Is that why we don't have enough staff to support?
It's a big problem. Here's the deal, that we have to go back in time a little bit. When the Healthcare Act was enacted back in like 2009, 2010, it came with a mandate called meaningful use. Meaningful use, that you have to use data and electronic health record. Well, because the way it was implemented, it was kind of almost forced into the healthcare system. And a lot of the doctors, a lot of the clinicians weren't used to utilizing the electronic records. They were using charting through paper and that type of thing. So it was kind of forced into it. So the workflow wasn't all that great. What happened is that a lot of clinicians were spending an hour with a patient and then 2 hours charting. Can you imagine? You're spending an hour actually delivering care and then 2 hours doing data entry. That did not make sense. It does not make sense, right? So we have to streamline how we're utilizing our technology to work with the clinicians, to work with patients, staff. So it's not outside of the norm. It actually augments what you're doing. It enhances what you're doing. It makes your life easier. So what we're doing is taking the friction out of the everyday workflow. We should be able to get real-time information to a critical application or setting or physician engagement immediately. Do we have the technology? Yes, we do. Has it been implemented? No, it has not. So now we're talking about all these different ways of doing it and actually making it happen. So number one, it's going to make financial sense. It's going to make the patient experience a lot better. But it also, more critically, is going to help that healthcare worker to have a more meaningful use of their time in a hospital setting.
I love that. Well, to close us out, because I don't want to give too much away, because we could talk about this topic, I'm sure, for hours. But right now, the focus for a lot of businesses and even in healthcare, everyone's talking about AI and GPT. And I just want to briefly get your take on is there a real opportunity for AI in healthcare? And if so, what does that look like?
Absolutely. Absolutely. It's about real-time information. Can you get real-time actionable information for decision support using AI? The first, can you trust it? Can you verify it? We're still at the infancy with AI. AI has been around a long time. Now, the AI chatbot, ChatGPT, is like, wow, man, I can get instant emails. I can get text information. This is great. But when you start looking at in clinical setting where that information has to be spot on, has to be absolutely accurate, are we there? Can we trust that information? So we're starting to get there because we're starting to look at the data sets that are available to make sure that information is actionable so that a clinician can look at that and have their menu of choices like, all right, that I see what the recommendation is. I can either do that or I can do something else, but I have enough information to move forward. And it's all about speed. It's all about speed to market. If I can do it quicker, I can do it more accurately, then I've got something that I can actually leverage in the form of AI, artificial intelligence, through whether it's a chatbot, there's other forms of AI as we'll get into, as more people get into over the next months and years as we move forward.
Love it. Grant, always insightful to talk to you. Really appreciate your thoughts today. And I look forward to seeing you in person here